Welcome to the Longevity Protocol with Dr. Christina Bosch and Dr. John A. Robinson. We'll be your guides to uncovering the secrets to optimal health, better sex, and happiness. From debunking aging myths to exploring the science behind what it means to live the Longevity Protocol, we'll dive into a wide range of topics. So, get ready for an exhilarating journey in what it means to live well and feel your very best at any age. Hello, my dear.
Hello, baby.
You know, peptides, this this word, peptides. And we've been doing this now for a long time. I want to really let everyone understand that we are not new to the peptide game.
No.
We were one of the first ones, I'd say. There was obviously others before us because I was learning from some other doctors that already knew about it. But this goes all the way back to about 2015, 2016 that we really started getting into it. And now it's, you know, it's all over the place. People are understanding it more. It's accepted more. Patients are asking about it more. And it's exciting. I mean, these peptides, these small little protein peptides that can be used clinically, and we have all of these different types of peptides in our body. They're like hormones, but they're not exactly hormones. They stimulate the cell, but not exactly the same way a hormone does. So from a clinical standpoint, we really tend to see virtually no side effects with these kinds of agents that we're using. You still, again, have to know what you're doing in the right context. You got to know which ones work well, what's the dosing, all of those kind of things.
That's what one of the things I was going to say was we've been doing it long enough to know which ones really work and then which ones are like, eh.
Oh, yeah. In the beginning, we were playing with all of them. And you know, again, we always say, you know, they call it practice medicine for a reason. And that's what's so wonderful about our patients. You know, they ask questions and then we say, well, let's try this. This is new.
It's new. We don't
figuring
know.
it out.
Yeah.
We very often, I mean, I've injected myself with all of these things.
I feel like we put ourselves through almost everything applicable.
Yeah. That
we ask patients to do.
Yes. Do not do something for a patient that you're not willing to do yourself.
Yeah.
Or, you know, at least do directly to yourself or be willing to do to yourself. And that's what we have definitely done. We practice what we preach. So today we're going to get into peptides, but particularly the top 5 peptides for longevity.
Okay.
There's many, many peptides. There'll be a link to a really interesting government-based NIH-based document that shows all of the peptides, things that I had never even heard of when I was
There's a lot of them.
Yeah, there's a lot. They're in the midst of research and not the typical ones you would get from the pharmacy, but there's so many of them, and they're using them, you know, in research studies for all kinds of things. But yes, because there's so many, even many that you can get from the pharmacist, we learned that over the years, some percolated to the top that were the usual suspects that we knew were going to be helpful because we saw just through clinical experience that they were actually helping patients through feedback and what we could see with lab work and those types of things. So top 5, number 1. Now this is kind of a section. It's not going to be just one peptide, but it's growth hormone releasing peptides. So many of these peptides can go into the body, stimulate different tissues, help other tissues to work. There is a particular type of peptides that help your brain, the pituitary within your brain, to secrete human growth hormone.
Right. Because we always say growth hormone drops with age.
Yes.
I mean, children are like abundant with growth hormone, hence them growing.
Yeah.
But it is a combination of things, right? So the body does slow down in its production, but there's also a reduction in the release of the growth hormone that we are making. So these GHRPs, a growth hormone releasing peptides, stimulate more production and more release.
Yes.
Okay.
Correct. That's a great way to put it because actually they've done studies with this where an aging pituitary actually has a lot of growth hormone in it. It just can't get out.
It doesn't get out.
Yeah. It's more freely moving out of the pituitary when we're younger. But as we get older, it's maybe getting produced, but just not getting out.
Yeah.
But yes, it's helping with production and release. So there's really 4 key types of peptides that are in this grouping. And again, I'm just calling number 1.
Yeah.
Sermorelin, which has been around since the 1990s. It's been FDA approved for children with short stature. CJC and $12.95. CJC is very similar to the Sermorelin molecule. It's just been sort of upgraded. Same thing with the other one called Ipamorelin, very similar to Sermorelin, but they were just sort of upgraded. And then the real upgraded one called Tesamorelin.
Right.
And Tesamorelin is FDA approved as Egrifta, which really, really is powerful at helping to decrease visceral fat, because human growth hormone really helps to decrease visceral fat, and Tesamorelin is just actually indicated for that. So all four are amazing. We've used combinations of these.
Yeah.
Some are a little bit more expensive than others. The patients can choose to, often we will start them with Sermorelin before we might move through these other things.
I do think with peptides, the price makes a huge difference, meaning some of them are definitely more expensive. It tends to be true, though, that the more expensive ones are more effective. I don't think that's always true in medicine. I do think it is true with peptides, but we're very comfortable at identifying what we think the patient is going to be most responsive to. Yeah. So you don't have to always just shoot for the most expensive one.
Absolutely. Speaking of a peptide, when it comes to semaglutide and tirzepatide, and now the newest one that we've been using, retatrutide. Semaglutide has been around. It's less expensive than tirzepatide and retatrutide. And a lot of times we will start patients with that particular weight loss peptide because they're going to likely get good results with that.
Right.
It leaves room to go up on the other ones if we think clinically we need to. But yeah, there's many ways to go with this to kind of have an entry into it and still get great results. Any of these will still give good results, but some will give better.
And we usually think of these Sermorelins, et cetera, this category for that general wellness, very longevity-minded, graceful aging, right?
Yes, because that's what growth hormone is doing. Growth hormone in and of itself is that quintessential anti-aging, longevity-based hormone that we will definitely look at for patients. Certainly once they get over 40, definitely over 50, we're strongly saying, hey, let's enhance growth hormone with your overall comprehensive approach to hormone replacement therapy. That growth hormone should be part of that. So instead of using actual growth hormone, which we do as well, we can use these peptides to get this production secretion that's already kind of sitting there and maximize things that way. So yes, it helps with muscle mass. It's helping with fat loss, particularly fat loss around the organs, improved recovery. That's one of the biggest things out of growth hormone. It's helping with recovery. It's helping with sleep. Love this particular category of peptide. Put it right at the top of the list of these top 5.
Yeah, for comprehensiveness, I think most patients that are looking to just enhance their wellness, this is a good medication. And also, how are you determining whether or not a patient is a candidate? Is a candidate.
Great question. We will check something called IGF-1. So IGF-1 is insulin-like glucose factor 1. It is the depot of human growth hormone. So your pituitary secretes growth hormone. That then goes to the liver, and then the liver produces IGF-1. So it becomes the best way, at least in blood, to determine where a patient's levels are at of their growth hormone. And then from there, we will try to optimize that number. And many times these will optimize that number. Sometimes, interestingly, they'll get benefit out of it. It doesn't really change the number all that much. And that's what's great about these peptides, that it's not always so important to make sure that that number has a linear change. And they still are getting benefit. It's very clear.
Yeah, the subjective survey is pretty impressive.
Yeah, and other objective things. They're gaining muscle, they're losing fat. They know for sure that they feel better on it. So we'll see that, but it doesn't always necessarily translate to a change on that blood test. But we're watching it and using it as a monitoring tool nonetheless.
Okay.
Okay. I think it is important here. One of the people talk about side effects. There's no real side effects to this. I've never seen excessive levels of growth hormone with any of this and causing a quote side effect. For the most part, we just don't see that. But it definitely can increase appetite. I've definitely seen that.
Yeah.
That happens even with testosterone therapy for men and women. Their appetite starts to change because their body wants nutrients in to start repairing itself. It gets this opportunity to start improving. So then it just comes down to what you're eating.
Right. I mean, I just want to say to that whenever a person is becoming healthier, there is an increase in hunger because the nutritional demands to keep up with a higher rate of metabolism are there. So I always try to say it's not really about appetite per se. It's that the person starts becoming more aware of those hunger signals. Those hunger signals become more obvious the way they used to be when you were an infant, right? So really, when you have an increase in hunger, I always say, great, that's a good thing. It's a symbol that your metabolism is indeed speeding up. The problem is for the person that doesn't know how to eat correctly.
Yes.
So it's important to bring this awareness to them, to say that it's a side effect with a negative connotation is not the case. It's just your body telling you, I need more nutrients.
Yeah. And to let everyone know too, virtually all of these peptides that we're discussing today will be injected as a small little subcutaneous injection. There's varying times in which you have to do it. It can be as infrequently as once a week, all the way up to a daily situation, sometimes 5. Most of these growth hormone releasing peptides that we're talking about here, 5 days on, 2 days off.
Yeah, we cycle.
Yeah. Okay. But injections nonetheless.
Good.
Number 2. Epitalon. Really love this particular one because Epitalon is probably I think one of the best brain types of peptides that we have. The one, there's other ones, C-Lank and C-Max, and the ones that I think we've seen the most benefit to brain has been Epitalon. This Epitalon is naturally derived from the pineal gland. So now we're talking about the pineal gland, real special little area of the brain that actually, as we get older, becomes calcified and doesn't function as well. And that's where Epitalon is coming from. And it regulates all kinds of things. But definitely one of the biggest things, it's helping to increase the length of telomeres. So telomeres are these little end caps that sit on your DNA, on your chromosomes. And as those telomeres get shorter, it decreases lifespan. And so if we can increase and enhance our telomeres, then we can live longer.
Longevity.
So it's definitely got that direct longevity benefit. It's antioxidant. It's definitely improving sleep because it's enhancing melatonin production. Probably one of the biggest things that it's doing too is what it's doing to melatonin, because then there's that sort of part of the brain. The pineal gland is helping with melatonin production as well. So love this particular peptide right at the top of the list.
Right. And so I'm just trying to summarize them. The Epitalon is more an affinity for the brain. Usually when we're identifying a patient, we're saying, well, what kind of peptides should I use? And of course you can use more than one because they have different areas of emphasis. But this is going to be one when you're really a person out there thinking like, oh, my brain.
Yeah.
Okay.
Right at the top of the list for brain. All right. Number 3, thymosin beta-4, TB500 is another name for it, but thymosin beta-4, it's one of the thymosins. Your thymus gland is kind of in the center of the chest. It has a lot to do with your immune system. There's various thymosins that are secreted, but as we get older, literally our thymus gland starts to involute and just kind of shrink and go away. So these thymosins are pretty amazing. I love this particular one because of it couples really well with the next one we're going to talk about, which is body protection compound, BPC. But thymosin beta-4 is actually helping to accelerate healing. It's working on the level of the DNA and helping with actual healing and cellular repair. It's really, really powerful with that. And again, it couples really, really well with the next one, number 4, BPC 157. So body protection compound, probably out of all of the peptides that we have seen over this past rough decade, that one is probably percolated to the top just in general for whatever reason. And it works incredibly well.
Yeah.
When it comes to recovery, sort of the Wolverine immune healing peptide is BPC. And again, especially when you couple that with the thymosin beta-4 that we just talked about, those two together it's a really wonderful stack for, I injured myself. And you can also, we have patients directly inject into the area of concern. We're using a needle that's incredibly small that, let's say they have a problem with their knee, they can inject directly around that area. And we feel very comfortable with them because the needle's so small, so they don't go in any kind of structures or anything like that. But they can get a localized benefit of putting both the BPC and the thymosin beta-4 right into that area and get some really amazing healing. It's usually a course of about 7-8 weeks. It's fantastic. But I do want to mention with the BPC that nowadays, so, BPC, again, this natural peptide, it comes out of the stomach, accelerated healing. It's helping with IBS. It's even helping to some degree with mood stability, because so much of it helps with serotonin production because it's a gut hormone peptide as well. But anyway, it's really not called BPC anymore. The government, in all its wisdom, kind of came down on many of these peptides, and one of them was BPC. So now you'll see it coined as pentadeca-arginate. And really what has happened, and kind of this is one of the things that occurred where it was a bonus.
Right.
Pentadeca-arginate just means it's the arginated version of BPC. And so it's the arginated salt. So it's when they make the particular compound, they put a little arginine molecule on it. But when they've done that, and many of the BPC medications that we would get was the arginated salt of BPC. And we just maybe didn't know it because everyone just was calling it BPC. But when it is arginated, it makes it more absorbable. Yeah, it's just better. The regular way, it's called acetate. It's just the basic way of doing that molecule. But when you put that arginine on it, it just makes it better. So now pentadeca-arginate, or the other way of saying it is pentadeca-arginate complex. It was like PDC or some PAC. That's what it is. So just know that there's different acronyms now for it, but ultimately it's BPC. But it's better.
And summarizing, the BPC, I think, is very commonly prescribed in my practice because of all the gut stuff.
Yes.
I mean, it's just anybody who's prone to having that upset stomach. And like you had mentioned about the gut-brain connection, I think a lot of my patients that are having GI symptoms, very typical female complaint is going to be that distension, that bloating after they eat, where they feel like they're 4 or 5 months pregnant. It's not so much the pinchable fat. I think BPC is a great indicator if you notice that your stomach in the morning is flat, but by midday it's already pooching out. And the relationship between the gut and that like low-grade anxiety or just general dis-ease is dramatically improved with BPC.
Absolutely. There's a lot of research with IBS, but ulcers as well, and ulcerative colitis.
Yeah.
So it's been used for that for a long time. And this is the one peptide where I was saying earlier that most of these are used as an injection. BPC is an injection as well, or again, BPC or PDA. It's an injection, but this is the one where actually you can get it as oral, right?
Which
especially
is great.
For the gut, like you're saying.
So
we
good.
find
Just get it right in there.
Right in there. And it's maybe a little bit more effective for the GI issues when you can take that one orally. But even then, if you're still injecting that, you get it systemically, and it still would help with the gut issues. But we find that the oral form's probably better for gut.
Cool.
Okay. 5, definitely not last. GHK-Cu. It's a copper based peptide. Look, if there's, from a regenerative aesthetic standpoint, and you're looking to improve skin health, this copper based peptide's amazing. In fact, all the peptides will come, they just looks, it's clear, but this particular one comes and it's like a light copper
orange.
Blue. No, it's a blue. It's a blue.
Okay.
You've seen it? I hope you haven't seen it. No,
yeah.
It's blue. Anyway, and you have to be careful with this particular one because you can kind of not really OD on it, but you have to be kind of careful because the copper can accumulate. But usually the way we're going to prescribe this wouldn't have that issue.
Well, I still think it perhaps dries orange, but okay. What I would like to say is that there's so many people out there using red lights.
Yes.
Like red light for your face.
Yeah.
And usually the indication is don't have anything on your skin when you're using the red light. But I have seen some mention in the literature about using the copper, the peptide topically before using the red light. And I have to look more into that, but I think that's really interesting. I think I'm going to explore that for myself and I'll report back on it. But it's one of those ways to really enhance, like you said, about skin regeneration for the face, the neck. You can put it on your hands. I mean, I think it makes a big difference in maintaining that youthfulness.
Yeah. And this has been used with hair as well.
Yeah,
So
that's right.
It can be part of an overall hair treatment process. We'll use exosomes and PRP into the scalp, and you can also additionally add this particular peptide in, whether that is directly into the scalp or again just taking it, really has just a fantastic benefit.
Microneedling. Using this with the microneedling is really great.
Yes, correct. So really, really excellent. So that's the top 5. There's definitely other ones. Yes, the semaglutides of the world. There's other ones. Probably the other one. Well, here's a bonus one. This isn't necessarily longevity, although I guess maybe it is, because it's bremelanotide, PT141. This is it's a female
libido, Viagra.
The female Viagra, guys can use it too. Works amazingly well for erections for guys. We prescribe this all the time, particularly for sexual health. And I guess if you're having sex, you're living longer. So that'll be the bonus one here to say that bremelanotide or PT141, that particular peptide, is helping with erections, helping with libido, female sexual dysfunction, and helping you to have better sex and better living.
Awesome.
Are you liking what you're hearing? Do you want to hear more?
Are you loving this great content and do you want to ask us a question?
Please like, subscribe, and comment.
You can find all of our links on our social media, featured articles, basically everything we cover at Linktree at Longevity Protocol Pod.
And if you want to understand and hear a little bit more about our personal lives, follow us on Instagram at The Sex Docs.
Here's where you can comment and ask questions that we will directly answer in our videos.
Be sure to subscribe to our Substack. This is where we get far more information for you, protocols on longevity and health, and definitely the notes for today's episode.
And finally, if you're ready to make a change, a real change in your own life, feel free to check us out at our private practice at hormone-zone.com.